Can a wisdom tooth removal result in facial pain known as trigeminal neuralgia? So we have a question here from one of our other videos where we were talking about trigeminal neuralgia, and it says, can trigeminal neuralgia be acquired from a wisdom tooth extraction? I think I have trigeminal neuralgia from a wisdom tooth extraction and have been trying to find answers. And a little further down, it says they're actually about to go and see a craniofacial surgeon, so a craniomaxillary surgeon, and whether that would be the right approach. And technically, yes, unfortunately, from any kind of dental procedure, particularly something which is bigger, like a tooth extraction or a wisdom tooth extraction, particularly if it was impacted. I know I had a couple of impacted wisdom teeth myself. That potentially can irritate some of the nerves in the mouth and the area, and that can lead to this facial pain because it is also a very densely dense neurological area, and it is very sensitive. So if something happens, it may be then. In terms of whether it was caused by the procedure, the dentist, I'm not a dentist, and even if I was not there, so I cannot say that they have necessarily done something good or bad or anything else. All I can say is that technically, yes, a tooth extraction of some form can potentially be a cause or a trigger for trigeminal neuralgia. Trigeminal neuralgia has a number of different potential causes. It can be due to, say, a tooth extraction. It can be due to certain types of infection or inflammation, whether around the mouth or other parts of the body. It can be due to a contorted or tortuous blood vessel passing through the area. It can be due to other growths or tumors, but again, these are much less likely and usually going to be ruled out quite quickly. However, another common thing, which I see a lot here in the practice, is if something is happening at that top part of the neck, because that can irritate the nerves which are coming up through here, the ones which are very close to the brainstem where it sends out the trigeminal nerve from the cranial nerves, and that can potentially be one factor. So while I say it can potentially be that the tooth extraction is a cause, it may also have just been a trigger if there was something else underlying which may have already been going on in the body. So it may just be that has then irritated things further, but something may have already been starting, or potentially it can be that that was the cause for the trigeminal neuralgia. But as I said, I'm not a dentist, and even if I was not there during the procedure, so I could not say that that was the cause of what's happening for you. Very sorry to hear about this. You mentioned about going to see the surgeon. I think at the moment, yes, it would actually be a good idea just to try and exclude things. Even when we see a patient here with trigeminal neuralgia, typically we're going to be asking them, if they haven't already, which most already have, but if they haven't, we would ask them, please go to see a medical doctor. Please make sure excluding any what we call red flags, anything which may be dangerous like a growth or a tumor, before we would ever want to start any care in our practice. Of course, we send for our own tests, we do our own imaging, but usually it's good to go down that path, whether it's seeing a craniomaxillary surgeon, whether it's going to see a neurosurgeon, somebody that's going to be checking the underlying potential pathologies, which may be a red flag or maybe causing the trigeminal neuralgia, before we start to examine other causes for it, whether that's going to be, say, something in the upper neck or other